I'm doing is taking a image of the straightness of the patient's spine, which, according to her mom, there you can stand up. Tell me what happened. Tell. I don't want to put words in your mouth, but 2 weeks ago, we put her through some maneuvers, which I call my therapeutic spinal pain maneuvers, the O'Connor technique or whatever. She had a very significant scoliosis before we did that.
Yes, she did.
And you went to some major institution.
I went to a surgeon.
Didn't you go to Loma Linda? To manage her scoliosis.
Right.
And tell me what they did for you.
Basically, they took an x-ray of her, they examined her, they said it's moderate scoliosis, and she can play soccer.
Did they call it idiopathic scoliosis?
No.
Just moderate scoliosis.
Moderate to, actually, the original x-ray and lab information said moderate to severe scoliosis.
Okay.
And that was the regular doctor.
Mm-hmm.
Not a pediatrician, but a general
Did
doctor.
you live down there, and that's why you went to Loma Linda, or did you go to Loma Linda because they represented themselves as
we lived in Southern California.
But did they represent themselves as a scoliosis treatment center?
We were sent to them. Basically, our insurance. There was a problem with finding someone that would take our insurance.
Mm-hmm.
And so my doctor called Loma Linda Hospital, and their department did take my insurance.
It was a spinal orthopedics?
Spinal surgeon.
Spinal surgery.
Spinal surgeon.
Okay, so they were high-powered people.
High-powered, yeah.
And
basically he said she didn't need to do anything, they would just watch it.
Mm-hmm. In other words, they didn't have anything to give you. They didn't have any.
They had nothing.
They had nothing to offer.
No, nothing to offer at all.
And
no, you took an MRI.
You had back pain, correct?
Yes.
Severe back pain, would you call it?
Yeah.
What is it now?
It doesn't hurt.
Did it stop hurting immediately after I did my maneuvers on you?
Yeah, it was a little bit sore, and then it didn't hurt after that.
Is there any doubt in your mind that what I did changed your spine?
No.
So that took away the pain, and now we just looked at her back, and you'd seen it before many times, so you knew the degree of scoliosis.
She had a big lump on her
A
back.
big lump?
It was a big lump, yeah.
And what do you see today?
I don't see the big lump anymore.
No, it went away. And the spine is almost straight right now.
It is.
So,
It is in one treatment.
so what I did was by replacing that displaced piece of disc material, I stopped her listing from the, I think it was the right to the left.
Right.
And then she was compensating by bending back over.
Exactly.
She doesn't have to do that anymore. And so this scoliosis basically was cured. And not completely, because it'll take time for the rest of that to bend, but this is quite, from my perspective,
It's dramatic from my perspective.
dramatic. It's not coincidental.
2 weeks ago, this was not like that.
Right. And there's no pain. That's the amazing thing. See,
Yeah.
and so as far as you're concerned, that wasn't coincidence. No. And do you think if she didn't have that, she'd have gotten worse over time?
Oh, absolutely.
Yeah. And she couldn't play sports. She couldn't have done things like she used because she would be bent.
Right.
But now she's pain-free, and her back is now remodeling in a straight configuration.
Yes.
Because what I'm saying she had was compensatory scoliosis, not idiopathic. Idiopathic means we don't know the cause of. Well, I defined the condition, fixed it, and now it's not idiopathic scoliosis, it's compensatory scoliosis that is now almost normal. And we'll see over time what happens. I can have I had an x-ray taken.
Yes.
And we will get another x-ray in maybe a month or so and see what degree of scoliosis has changed in that time period. Because most of this may have been caught in time before permanent remodeling of the spine occurred.
It's amazing to me how this could have changed in 2 weeks versus us screaming at doctors for the last 4 years,
Uh-huh.
virtually. I mean, for 4 years,
Right,
you know,
right.
this has been going on.
Well, that's why I'm filming it, because it is amazing.
It
What I'm
really
doing
is.
is amazing, and
Yeah.
nobody really believes that I can do this.
Yeah.
But I want
We believe that you can.
I want to document that this is not just me saying so.
Right.
This is real, and we'll have some X-ray proof of it in a few months or something that cannot be
You have
refuted.
visual proof of it right now because there's no lump on her back.
Right. Now, do you mind if I use this, either of you mind, on my website? Because there's no pictures of anything, you didn't see your face or anything like that.
Yeah, that's fine.
Okay, great. Thank you very much.